That's an important and interesting question. As mentioned, we've only been tracking this condition for about 20 years, so we actually need more time to figure this out. What I mean by this is we can be biased if we're only following the most severe patients, as there are plenty of people out there with EOE that actually don't know it yet. And there is variability. What we worry about, and the ones that we probably deal with the most, are the ones that actually get narrowing of their esophagus. And we can do backwards looking and say, well, there's numbers such as half patients after 10 years of untreated EOE will have narrowing, but I do believe there's a lot more patients with it that likely don't even know it. So answering the question backwards is, will they have it going forward? For now, we are telling people that this is a condition that they will continue to have. Having said that, it doesn't necessarily have to be a major problem. And maybe the ones that are found, like was mentioned early in life as infants, they may be the ones that, with their overlap of other things that they can outgrow, those are the ones we need to follow and continue to see. So it just highlights the importance of following with your gastroenterologist and talking about both maintenance scopes as well as clinic appointments. So the answer to that is absolutely. It's true that giving a label of a chronic condition means a long-term condition can be daunting for people, but ultimately that's how we know we're doing a good job, is if your child or the patient themselves is annoyed by having to have follow-up, but having normal activities, physical activities, should be no different. School expectations are no different. Career ambitions are really, there's no reason to tailor or alter those. And really, we know we're doing a good job if their quality of life is good, number one, they have minimal symptoms, and then let us worry about what is the last count of the eosinophils. It's an important thing to have in context, but overall, we expect every child with EOE to be leading a fruitful and a healthy, long life. So that's a good question. I think we've talked about how at presentation there's different symptoms that may present, and sometimes there's overlap, but it is true that once they're well-established, school-age, teenagers, I do believe that the symptoms are relatively stable over time. We are interested in studies in how patients transition from childhood to adulthood. And, there's some interesting findings in terms of, one, it goes from a reliance of parents reporting to the patients themselves. And sometimes there's even a difference. So we even ask sometimes separately, what do you think are your symptoms? How often do you have and how bad is it? And they don't always match what the parents are saying. But it is important to kind of keep tabs. It's partly true that the patients get used to these symptoms. And that can be a good and a bad thing. Sometimes that allows them to minimize them or not acknowledge them as significant. But for the most part, they adapt to it. One of the things we don't see change a lot, even when the inflammation is controlled, is those kind of defensive type practices where I say they're kind of slow to eat. And, they tend to still always, if they felt more comfortable, wash, or even if they've had a choking episode, it's still going to be a long while before they really truly feel comfortable in eating the same food or eating at the same rate as others. But for the most part, it's generally stable, and it's not necessarily a worsening course with time. So it's not kind of the analogy of a time bomb necessarily, but highlighting the point is everybody's individualized. You do need follow-up with your GI doc, and they're the ones who are going to check in with you. And it's really too much for you to say, are your symptoms the same as they were a year ago? If you have someone helping you keep track of that, it's a lot easier. So keep in touch with your pediatric gastroenterologist as a child and make the shift, even if you're feeling pretty well, to your adult gastroenterologist for ongoing long-term continuity.